The city of Corpus Christi is officially taking over the existing city-county health district. The decision comes following a final vote taken during a special meeting with Nueces County commissioners. The changeover goes into effect Tuesday, March 1st. The new business model and partnership agreement means the city will exclusively operate the health district, with the county acting as a customer in this partnership. The move to change who runs the health district is coming with many questions about the care you're currently receiving during this pandemic, and to help us better understand and navigate what you should continue doing with this during the switcheroo, Dr. Salim Sourani joins us live. Dr. Sourani, good morning to you. Nobody said breaking up's easy to do, and we're not going to get into the politics of what's going on over there between the city and the county. But as a consumer, as somebody that watches the news and sees the health district reporting numbers when it comes to COVID during this pandemic and all the different information they have, what should we glean from moving forward? Is anything really going to change for us?
Good morning, John. Happy to be here. One of the good things is patients are not treated in the executive suites. They're treating in the emergency room and the hospital floor and the ICU. So, the healthcare system is not immune to the changes in the admin and changes in the structure. Hospital undergoes the changes all the time. The contract changes. The national company contract changes all the time. But if you look at it, the redundancy in the system is really great, that the care of the patient when it comes down, it's seamless. It's delivered at the ground level by the frontline worker. So if you're sick, you are going to continue to receive the same level of care what you have received. If we don't hear those changes in the media, we probably will never anticipate too much of the changes. There are some process changes which is going to go, but does it mean that it's going to affect your care a lot? Answer is no. You probably are going to get the same level of care what you have been receiving, and your care would be the utmost important. It doesn't matter whether it's city taking it or county taking it. They both have one purpose in common: to make sure your health is taken care of.
So the message might just be coming from a different talking head, but as far as us and what we need to know, we'll relay that information to our viewers naturally. But just moving forward during this pandemic, taking our cues from public health officials, especially a person such as yourself, just some real quick common sense things to pay attention to moving forward.
Yeah, one of the things is that during the pandemics it's tough, but on the other hand, at least we are seeing the cases goes down. And one of the things is that the overall budgetaries and the grants and all those are going to come in. They're still going to be worked out, and the care at the ground level, I think it hopefully is not going to be affected, and it should not affect it. And that is what everyone works toward. Everyone, when they go in, they want to make sure that everyone gets the better care in whatever way they can, rather than trying to take a notch down. The goal is always at the E-Suite is to make sure how we can serve the community and the patients better.
Okay, Dr. Sourani, I look forward to the day where we don't have to talk about the pandemic anymore, but we are, and we do consider you an authority here. So we appreciate your insight on this. You'll be talking with Barbie in the next half hour about how to add 10 years to your life. Looking forward to that. We're all smiles here. And if you have a question for Dr. Sourani, send us a text at 361-855-6397.